straight through. Geez, look at that.
His eyelid split open, you can see.
Yep.
He saw my son, got very excited, and just bolted down the stairs and across the street.
Cody, a young Labrador, has just been run over by a car.
He's got a fair knock 'cause he's got a bit of hemorrhage around the eyes there. His gums are fairly pink there. I wouldn't say they're a rich pink, but they're pink enough for me right now. Heart rate's obviously very high, just because of the stress, but lung sounds are okay, and you can see that general respiratory rate isn't too bad. He is panting, that's a result of the shock. Yeah, I just can't believe these tyre marks here. And that's all rubber along there and then down here, so geez, it doesn't look as though the wheel's gone over him, but it's certainly given him a pretty big bump. His oxygenation's at 94%, 95%. It's a little bit low, it should be above 96.
Low oxygen levels can be a sign of internal bleeding. If it isn't stopped immediately, it can quickly kill.
Cody has been hit quite hard by that car. If that hit's been big enough to sever a blood vessel in the abdomen, then that could be life-threatening over the next hour or so.
It's all right.
Felix.
Meanwhile, at Bondi's referral hospital SASH, a 5-month-old Burmese kitten has just been admitted with a mystery illness.
Well, Felix was absolutely fine until yesterday, and this morning he didn't eat his breakfast, and he was really down, and he's usually a lively little kitten, and his skin was all dry, and then he started retching and vomiting and diarrhoea and just being really floppy.
He's reacting when I'm touching his kidneys. Felix is in a lot of pain. Cats are normally really stoic animals, and he's yelping out when I'm feeling his abdomen, so he's in a lot of pain over there.
Have you eaten something not nice?
It's possible that he could have swallowed something. He's a young cat, and kittens play with things, so...
Indoor, outdoor?
Yeah, they ingest lots of different things, and it's very possible. I can't feel anything obvious there, so he's a very sick little kitten. Yeah.
Felix is your friend, isn't he? You're a bit sad as well.
Let's just hope it's something that we can fix.
Listen, they've got him on the table, they're giving him a bit of oxygen.
Cody, the Labrador, has been hit by a car, and Chris is worried about internal bleeding.
Basically, my concerns are the fact that our oxygenation level is low. His breathing certainly isn't great. He's panting a little bit, so we just need to stabilise that with some oxygen and just try and calm him down with some medication as well.
Brendan started crying. Oh, that's sweet. That's my son. He had a meltdown. Right.
NATAN's 9-year-old son Brendan was there when Cody was hit, and he's rung up for a progress report on his canine friend.
Cody?
Who's that? Brendan? Talk.
Hello, boy. Are you all right? If you're all right, I have a treat for you at home.
No, he'll be okay, Brendan. Okay, so don't worry about him. He's in good hands.
Hi,
Lara, you're on speakerphone and Cody can hear you.
Little sister Lara is next on the phone to check on the patient.
Yes,
But she seems more worried about the vet's condition than Cody's.
Right.
Is he fat or not?
No, he's not fat. That's my daughter. She's got all these very pertinent questions. What if I was fat?
I don't know.
Should probably say you got the biggest loser like Daddy. Bye. If anything changes, I'll call.
I promise you I'm looking after him. I'm very worried.
Oh, my son is, how to put it, a little emotional.
It's quite a nice, healthy reminder about the fact that, you're not just treating the patient here, you're also managing the emotions of everyone that's waiting at home and expecting good news here. So hopefully we can actually give it.
Let's get some blood off him to try and give us an idea of what's going on.
5-month-old Felix has been rushed into SASH with severe abdominal pain and a high fever. Lisa is running tests to work out why.
He's a pretty sick little kitten. He's got a temperature of 41.3, which is quite high. He's definitely got abdominal pain, like you mentioned before. He's groaning when I'm pressing. I wonder if it's his kidneys that are sore. It's really hard to say because there's so many organs in there. we need to try and work out what's going on, because to have that amount of pain, there's got to be something nasty going on in there.
Good boy, good boy.
With the signs that Felix is showing, I guess I'm concerned about an infection of the kidneys, pancreatitis, and another disease which is called FIP, feline infectious peritonitis. Oh no, you're not going to put up with us for much longer. If he's got FIP, it's really bad news. It's a fatal disease and there's nothing we can do for them. And it's just not something that I want to go and tell his owners. You want to give your mum and dad a cuddle? Felix is a much-loved little kitten. He's their baby and they're really worried about him. Hopefully I'll have some more answers for them by the end of the day.
I'll call you later, yeah?
The tail just keeps on wagging there, doesn't it?
It's a happy
Typical
boy.
Labrador.
Happy boy.
You've been hit by a car, okay? Try and act like it.
Cody is one lucky dog.
The oxygen level's coming up really nicely.
It's great news for NATAN. Cody's oxygen levels are climbing and the threat of internal bleeding is now over.
Cody has been hit by a car. The whole right side of his body is covered in tyre rubber. Yet his tail's wagging and I'm okay for him to go home.
You're a very good boy.
It just adds a little bit of weight to this theory I've got about Labradors. Nothing worries them. They're great dogs for that reason, but they wouldn't be winning any IQ test competitions.
Clearly, Cody's starting to feel better and more relaxed.
You gotta love your job sometimes.
That's all right.
That's all right, it's part of the job.
A few stitches for that cut eye and the lucky patient can go home.
What an amazing recovery. Cody came in looking extremely stressed and he leaves with a smile on his face, all after being hit by a car. If all hit by car cases could go like that, then my job would be all smiles.
Over at SASH, Felix's blood results are in and the news is not good.
He's got a white cell count of 35, the upper end of normal's 19.5, so that's a pretty significant elevation.
A high white cell count indicates inflammation of the organs. This means it could be FIP, a disease that attacks the entire abdominal area.
FIP is a fatal disease and there's nothing we can do for them, so I'm a little bit scared that that's what he's got, and I'm hoping that's not the news I'll have to break to his owners.
Felix will need an ultrasound to clarify the diagnosis.
She just had a seizure.
But before that can start, there's an emergency in the treatment room.
I need someone to tube this.
All right.
She's stopped breathing.
Bianca, a 14-year-old Maltese Terrier, has suffered heart failure. When a dog crashes like this, everyone is required to deal with the crisis.
There's not much talking, everyone works on autopilot and you know what you have to do, and it's got to be done quickly if you want to get the results.
Heartbeat's wrong, 20.
Fortunately, the vet stabilised Bianca within minutes. Now they can turn their attention to the ultrasound that will determine Felix's future. Chris is now heading to the bush for a special visit.
It's just so good to be back around here. I love this country. Not that you can really see much with all the fog around, but to be back here in a place where I spent a lot of time as a kid and also did a lot of my prac work during my vet course with Rusty, and to be asked to be the official vet at the Stroud Show, it's a big honour and we're looking forward to a very big day, aren't we, Russ? In terms of jobs, this is a pretty easy one so far. It's very different to the Easter show, but I like it because you've got two cows here competing against each other, so you're a fair chance of a ribbon here. In fact, you're guaranteed of a ribbon here.
Walks out nicely, a very worthy winner.
There you go. He's a beauty. Well done.
Hey, come on, Stroud, let's get ready
the bulls are doing just fine. Health-wise, they're great. It's the riders I'm actually worried about here.
He knows for the gate. He will get out. 5 markers and will make 110% effort.
I think we should probably actually go and see if he's all right.
You right, Clive?
This was me win.
Our major sponsor this weekend is the
A little bit.
Where'd you hurt yourself?
Just hit the paddles. Just on the leg. Nothing serious.
Don't need a vet, do you?
Nah. Danny a bull.
You're an animal, you do need a vet after all. Okay, I'll get there as soon as I can. Thanks, Juliet. Okay, bye. Come on, buddy, come on, we gotta go. I just had a call from a farm really close to here. Ironically, it's the dairy farm I did my prac workout. It's unbelievable. It's the Clarks. They're a lovely, lovely old couple, and they've got Guernseys and Friesians, and apparently one of them's having severe trouble getting a calf out, so getting there as soon as we can.
Righto, she'll come in. Membrane to training, I've seen one foot, not the other. There should be soap on top of the fence there.
The calf is stuck and the situation is becoming critical.
First of all, I feel for the legs, and one leg's bad, 2 legs is great. Yeah, 1 foot. I've got a head there as well.
Hot little belly.
At the Bondi Referral Hospital SASH, Lisa's about to find out the fate of young Felix.
In this ultrasound, we're looking for signs of inflammation, any free fluid, enlarged lymph nodes, abnormalities in any of the organs. We're also going to have a look at the pancreas and the kidneys to make sure that they're not inflamed.
Vet Darren Foster is hoping only one organ is affected, which would rule out FIP.
So the fact that you're seeing it like that is very significant.
Yeah, and that's where he's most painful as well.
Oh, I really hope it's not FIP. Worst case scenario for Felix would be that he has feline infectious peritonitis, which is a really nasty disease. It's a terminal disease and they can have days to months to survive.
The kidney and bladder are given the all clear. Now Darren checks the pancreas.
Just down here, he's got this black spot through here.
Yeah.
And all the fat around here is quite inflamed, and that black spot, I think, is his pancreas.
Oh, pancreas.
Yeah, so I think actually he might have pancreatitis.
Well, that would be best case
The
scenario.
best case scenario for little Felix.
The pancreas is a gland that produces enzymes which help digest food. When inflamed, it's very painful.
Probably from bacteria that get in up from their bowel and infect their pancreas, or just from sudden dietary changes, dietary indiscretions, eating mice.
Are you happy?
That's great.
You really happy?
Yeah.
Okay, good. If you're happy, I'm happy.
The treatment for pancreatitis is lots of fluids, antibiotics and pain relief.
All right, little Felix, I think this is your lucky day. Huh? Let's get you back in your cage. I know. Come on.
Just want to be able to feel both legs and make sure the calf's actually facing the right way.
On his visit to the country, Chris has taken a call to help this distressed mother-to-be.
You can see she is pushing, which is good. She's not making much progress at the moment.
Dairy farmer Juliet has been on the land all her life and has seen hundreds of calves born.
You get some stillbirths, chiefly from big calves, but sometimes difficult positions.
So how long has she been in labour for?
An hour.
The longer the labour, the greater the risk to both mother and calf.
How many calves has she had?
7 years old, so a few, yes.
She's getting some good contractions there. Okay, so you can see the feet are starting to appear here. Had a bit of waters breaking. Now, let's grab one of those ropes there. Thank you. It's like trying to tie your shoelaces in the dark while someone tries to
push you off your feet. It's difficult because everything's pushing in and moving your hands away from where they should be, and it's a challenge. Give it a bit of a pull. Here we go. And you can see it's a fairly big calf. Explains why she's having trouble with it. There we go.
Hey, sick of being in a cage.
At SASH, Felix's treatment for acute pancreatitis is already working.
Felix. Felix is doing really well. His temperature's come down to almost normal, still slightly up, but he's definitely feeling a lot more comfortable in his belly. You're a monkey. What? You want to go home? You want to go home?
Oh, it's Felix.
It's your baby. Felix.
There you go.
Oh, it's just fantastic news. I can't believe he's so well after less than 24 hours. It's amazing. After yesterday, I thought it was pretty grim. I didn't think he was going to make it. Good boy, hey? He's worried us sick. Lovely to have you back, hey, mate?
Yeah.
There you go.
Oh. Who's going to give him a kiss?
Yeah,
Mariki, what about the kiss for the cat?
Kiss for the cat. Good boy. Hey.
Beautiful boy. Thank you.
Push. Almost there.
Chris is trying to deliver a stuck calf.
So we've got the head out, we've got the front legs. Go on, girl. See the shoulders, which is a very wide part. Sorry, girl. There we go. Good work, good work. Just got to clean out the mouth. The calf's alive. It's important just to get in there and get all the mucus out of the mouth. Hello, welcome. Welcome to the world. We'll just get up there and give it. Try and drain some of the fluid out. We're nice and alive. It's almost good to, it sounds cruel, but even annoy them, just trying to get in their throat and go up their nostrils, just really stimulates them to breathe and open up their lungs. Hey, look at you all slicked up. Yeah, little heifer, little girl. This is an important bonding moment for the two of them, but she's trying to get the calf nice and dry so it doesn't get too cold. And just these little grunts she's giving them, just saying to the calf, look, I'm your mum, welcome. We've had 9 months together, but this is the first time we've actually seen each other. So, you know, it's a very special time for her. This little one's all a bit confused about what's going on, aren't you? You're beautiful. Ready to face the world, aren't you? But no matter how many times you do this, it's always pretty special.
Her name's Ivanhoe Zing. She's got a father's name and a mother's name.
Oh, nice. Already named too.
Oh, yeah.
You're efficient, aren't you?
After just a few minutes, it's back to the milking shed for Mum.
It's a tough moment, Mum leaving the calf after she's had her inside her for 9 months, and then, you know, it's over like that. But it's farm life, you know. It's very real.
Back at Bondi, Cody, the lucky Labrador that survived being hit by a car, is in remarkably good shape.
It was a really close call, and we're just so lucky that it's all worked out for the best. He nearly got very seriously injured, and we're just lucky that it's all better now, and we've certainly learnt that, you know, we'll keep him closely guarded to us next time.
And remember Brendan and Lara, who chatted to their injured friend over the phone? Well, they all know the new rules for Cody.
I think we should always keep him on a tight leash unless there's no cars around or it's a park.
You can't get me any more dirty, so let's go. Oh, it's like a big black Labrador, only slightly different.
Chris has just helped deliver a beautiful female calf.
Juliet will never say it, but she'd be absolutely thrilled it's a girl. Males around here, unfortunately,
they're just of no use whatsoever. It's the females that produce the milk. This is a dairy farm. They rely on the milk to make the money. So females are all the go. You don't get much milk out of a male. Come meet your new friends. You know what? They've been through exactly what you've been through. Oh, gonna use these?
After a warm welcome to the nursery, it's time for Ivanhoe Zing to try out her shaky legs.
You good, you good. It's that little right one. Hey, well done. You made it. You made it, girl.
Hi, I'm Dr Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.